and I lead on the transition program that we do here.
Good afternoon, Jackie. We're happy to hear you. Can you hear me?
Yes.
Good afternoon, and we're so happy to have you here.
Thank you.
Let me introduce myself. I'm Dr. Mohammadreza Sani, Pediatric Pulmonology Fellowship of the Tehran University of Medical Science, and this is a CF short course for nursing specialties for CF. There are 68 persons from 40 provinces, and we are happy to have you here. I want to remember that at the end of your slides, I have to interrupt you to translate for the audiences here. I'd be so thankful if you let me have this time.
Okay. Thank you. So the aim of today is just to give you an overview of what we do here in terms of transition service at the Royal Brompton Hospital. So I've put up here 3 definitions of transition, but the key aspects are that it should be a planned process or a pathway, but not just a transfer to another service, so that the individual feels that transition has been defined, because transition has been defined as being purposeful, a planned movement of adolescents and young adults with chronic physical and medical conditions from child-centered care to adult-orientated health systems. And I'll just quote that one for you, and I'll leave you to read the others.
You continue, Jackie. Yes, you continue.
Yeah. It's a time when we sort of focus on preparing young people to develop independence, their knowledge and skills and understanding and navigating their way through toward the adult healthcare settings. It should be introduced early with parents and the children. And we talk about transition from a very early age. Even when they come as babies, we say one day you'll be going to the adult service.
مسئله که مهم هست این هستش که این فقط یک انتقال ساده نیست، یک انتقال مکتوب هدفدار و برنامه‌ریزی شده از سرویس کمکی و بزرگسالی هستش و باید توجه بکنیم که نوجوانان در این سن در جستجوی مسیر زندگی خودشون هستن، یک راه زندگی خودشون رو پیدا بکنن، باید حس استقلالشون رو حتما در نظر گرفت و یک برنامه انتقال مکتوب مدون و برنامه‌ریزی شده رو برای انتقال به سرویس گذار از سرویس کمکی بزرگسالی در نظر داشته. Yes, Jackie, you're with you. Thank you.
Thank you. From a parent's perspective, they feel like they've been building this for a long time. So it's like building a boat that you eventually launch. The building process is gradually gratifying, but so is the launching of the boat, and seeing that the young person is built ready for those rocky times on the seas and transitioning through the process. At some point, as a parent, you've got to start getting your child ready to launch. So getting them ready to be independent and going and asking questions for themselves.
والد بودن مثل اینه که شما در حال ساختن یک کشتی هستید، در حال ساختن یک قایق هستید که این بالاخره روزی مجبور میشین این قایق رو به آب بیاندازید. و اگر این قایق بناست به آب انداخته بشه، شما باید برنامه‌ریزی داشته باشید که بتونید این کار رو انجام بدید و این رو بپذیرید که نهایتا این کودک شماست که باید قایق رو در سطح آب ببرید.
So this what I put up here is some figures from the CF registry of all the patients in the UK. So we roughly have just over 11,300 patients in the UK, and of that, about 60% now are of adult age. So that means 16 and over. Life expectancy in the UK has obviously increased, and life expectancy is getting better and increasing over time, with new modulator therapies now in play. Approximately 60% of the UK population are adults. Adults with CF want to do what their counterparts want to do. As you can see, a lot of them are in work. So 70% are in work or in education of some form. And we have a few that have actually retired. So those have reached retirement age of about 60 to 65. So we do have older patients with cystic fibrosis who are now retired. And we will probably see that population growing even more so in the coming years. The other thing is that people are getting older with cystic fibrosis, but they're also fitter with their CF. The CF care has improved. And so there are more pregnancies, and we're finding that in the UK and elsewhere as well within Europe, that the pregnancy rate has gone up for young women who now want to have their own families, and also for young men.
در مراقبت که از بیماران CF پدید اومده، مسائل جدیدی کم کم در جامعه انگلستان به وجود اومده. طول عمر بیماران CF افزایش پیدا کرده و متوسط سن فوت در زمان متوسط سن در زمان فوت به 46 سال رسیده. 68% افرادی که
So you can see that I know you don't have modulators, but we can see from this slide that we get at least maybe just over 150 to 200 new patients diagnosed every year that are greater than 16 years old. So we do get a population of older patients being diagnosed. And these figures are taken from the registry from 2023. And you can see that with the new patients, we also have a few deaths. And in 2023, we had 49 deaths. So the population is increasing, and the population in 2023 increased by 124 new patients. So it is a factor that we just need to make sure there is provision for those getting older with cystic fibrosis.
جمعیت CF به خاطر اینکه داره مراقبت‌ها بهتر انجام میشه در حال افزایش سن هستن و اون به تدریج با افزایش سن جمعیت CF ها داریم مواجه میشه. تعداد بازنشسته‌های CF در حدود 184 نفر 2.8% بوده و به تدریج داره رول‌ها و نقش‌های جدیدی برای افراد مبتلا به CF تعریف میشه. مثلا رول والدی، نقش والدی، نقش پدر، نقش مادر. 116 نفر در سال 2013 مبتلا به CF خانم باردار شدن و 31 نفر مرد پدر شدن و با آمار میزان مرگ‌آمد هم در طی این سال‌ها شروع کرده به کاهش پیدا کردن. اما در حال مشاهده جمعیتی از بیماران CF هستیم که سن و سال بیشتری دارند.
So we can see it can be a difficult process as young people and young adults and their families are concerned about leaving one service that they've known very well and having to introduce themselves to a new service who they don't know. And so for that, communication is key to this process, involving the young person themselves, the families, and also our adult counterparts in our service. We're lucky here. We have an adult team based at the hospital. Lots of other children's hospitals do not have that process whereby they have to refer the children onto another centre.
از دوران از خدمات کودکی به خدمات بزرگسالی یک روند دشوار و چالش برانگیزی هستش، به خاطر اینکه نوجوانان معمولا با تیم قبلی که داشتن خدمات مراقبتی و درمانی رو براشون انجام میدادن پول گرفته بودن و اینکه بخوان اون تیمی رو که قبلا باهاش آشنا بودن و اون شرایطی که باهاشون آشنا بودن ترک بکنن و وارد یک تیم جدید بشن سخت. با این حال این بخشی از رشد. نکته اصلی و کلیدی در این گزار ارتباط هستش که حتما باید ارتباطات خوبی بین تیم‌های خدمات کودکی و نوجوانی برقرار باشه و خود اون درگیر شدن نوجوانان و جوانان نکته کلیدی ماجرا هستش و یک همکاری تیمی مطلوب بین تیم ارائه دهنده خدمات CF در کودکی و تیم ارائه دهنده خدمات CF در بزرگسالی تضمین میکنه یک گذار نرم از تیم خدمات کودکی به تیم خدمات بزرگسالی انجام بشه.
Sorry, that was the fire alarm. Practice. So for our young people, growing up is a big thing for them. Going off to secondary school is also a big thing. So involvement in decision making is one thing that we try and include them in. So from the age of sort of 14 or even before then, really, we talk to the young person when they're in clinic, talk about what they want to know, if they've got questions they want to ask. And this is something that we do at annual review. So trying to get them to take on some of the responsibility for their own health is really important. And trying to make sure that we prepare them and prepare the adult team for them coming to them. So trying to provide an uninterrupted healthcare movement from pediatric service to the adult service. We also talk about the things that they worry about in terms of their careers, what they're going to do as a job, expressing themselves, whether that's something they wear, how they are, what music they like, etc. So, and being safe and knowing what's safe for them to do in terms of, we talk about smoking, we talk about drugs, we talk about all those other issues with the teenagers. We also talk about delayed puberty and physical appearance, but that seems to be not such a big problem here. I don't know for your population. Nutrition is key, and so a lot of our children are growing normally, and hopefully some of them are having delayed puberty, but most people are going through puberty okay. So we do have problems with growth sometimes, and they can be referred for things like growth hormone, but generally they are very well.
معنی این هست که نوجوان در تصمیم گیری هایی که قراره برای خودش رو انجام بده دخیل باشه و دخالت داشته باشه، مشارکت داشته باشه. اغلب بچه‌هایی که نوجوانی که به کلینیک‌ها مراجعه می‌کنن وقتی باشون صحبت می‌کنیم نیازمند این هستن که آگاه بشن راجع به ماهیت بیماری که دارن و خودشون مسئولیت سلامتی خودشون رو به عهده بگیرن. نکته خیلی مهم دیگه که وجود داره اینه که در گذار از سرویس ارائه‌دهنده خدمات کودکی به بزرگسالی وقفه‌ای به وجود نیاد و این مراقبت بهداشتی بدون وقفه انجام بشه، بدون توقف و بدون وقفه انجام بشه. ما سعی می‌کنیم که به نوجوانانی که مراجعه می‌کنن به این کلینیک‌ها زمان اختصاص بدیم تا احساسات خودشون رو بیان بکنن، راجع به شغلشون صحبت می‌کنیم، راجع به نقشی که قرار در اجتماع داشته باشن، راجع به مسائلی مثل مصرف داروها، مواد غیرقانونی، مصرف مواد مخدر، داروها، مواد غیرقانونی که ممکنه نوجوانان تحت تاثیر قرار بده، مسائل جنبه‌های زندگیشون صحبت می‌کنیم. مسئله دیگه که باهاش ممکنه مواجه بشیم مسئله بلوغ تأخیری و ظاهرشون هست که البته میگن که معمولاً اینها مسائل خیلی حادی نیستن و کودکانی که به کلینیک‌های ما مراجعه می‌کنن برای ویزیت‌های سالانه عموماً حال عمومی خوبی دارن.
So there's a lot going on in the teenage brain, as you can see from here. So there's a lot of things that happen. Sometimes they rebel against their treatments. They want to know things about having children themselves, particularly the boys. They want to know about those issues. They want to know about their relationships and going off to university, what's going to happen then, who do they call, what do they do if they're unwell. So there's a lot of things that are going over in their mind about what's going on for them in terms of teenage years. Like any other child without CF, they've got enough to cope with as well as their CF.
اصلاحی که مشاهده می‌کنید در واقع آناتومی ظاهری مغز یک نوجوان یا یک تینیجر رو نشون میده که مغز این کودکان و این نوجوان در این مسائل بسیار مختلفی هستش و این لزوما مختص به بیماران CF نیست. در هر سنی در سنین نوجوانی هم ما با این مسائل مواجه هستیم، مسائلی که بعضی از چیزاشو در تصویر می‌بینید و حالا برای بیماران مبتلا به CF چالش خود CF با کنار گذاشتن و مواجهه منطقی با CF هم علاوه بر مسائلی که نوجوان در این سن باهاش مواجه میشه هم مطرح هستش.
They also worry about things about sexual health, which is covered at school for a lot of our children, but also we need to cover it in terms of fertility, contraception, and sexually transmitted disease in terms of our CF population. So that's something that we do with our teenagers. We also talk about severity of disease and the things that might prohibit them doing a particular job. So that's really important. And we're lucky here, we have a hospital school, and they have a careers advisor here, and they can help with some of the issues around what would be appropriate settings for employment. And so that's really helpful in terms of severity of disease, that they may not be able to work, and then how do they continue their life in terms of benefits, etc. The other issue they think about a lot, because you know, some of our patients, and I'm sure yours do too, have siblings or friends who've died of cystic fibrosis. So they think about that and their mortality and what the future holds for them in terms of when am I going to die and when I'm going to die, because they always thought, a lot of older CF patients now were thinking that and haven't prepared themselves for careers outside of you know, growing up and leaving school. So it's important that we talk about those issues in terms of death and dying, and their fears about that as well in terms of psychological help, particularly those who've lost siblings and friends.
بهداشت جنسی هستش در مورد کودکانی که مبتلا به CF هستن و درباره مسائل مثل بارداری، مسائل داروهای ضد بارداری و STD یا بیماری‌هایی که از طریق تماس جنسی منتقل میشن صحبت بکنیم. موضوع دیگه که موضوع مورد صحبت هست شدت بیماری هست که میگه ما خیلی خوش شانس هستیم، بخت‌نمایان هست که در انگلستان مدارس داریم که بیمارستان‌هایی داریم که در کنار مدارس هستن و ما کمک میکنن که این شدت بیماری رو تخمین و ارزیابی بکنیم و این شانس رو داریم که بیماران رو به طور مستمر تزریق بکنیم. یا موضوع دیگه هم که مطرح کردم موضوع مرگ و مردن هستش که بیماران CF باهاش مواجه میشن، به خصوص وقتی که میبینن یکی از اعضای خانواده یا یکی از دوستانشون به علت CF فوت میکنن و این سوال رو میپرسن که آیا من هم قراره بمیرم و اگر قراره بمیرم کی قراره بمیرم، که پاسخی که من به این جور مسائل داده میشه اینه که بعد دوست دارن که بدونن که آینده درمانی CF براشون چه برنامه‌ای رو مد نظر گرفته و درمان در آینده زندگی رو چه شکل در میاره و چیزی که ما باهاش مواجه هستیم اینه که درمانی که جدیدتر داره برای CF ارائه میشه باعث شده که بیماران CF افزایش پیدا بکنه و بیماران CF مسن‌تر باشند.
So why do we transition? I mean, it is important. It's part of growing up. They transition from primary school here to secondary school. But also it's no longer, cystic fibrosis is no longer a childhood disease, particularly in the West. I'm not sure in Tehran how old your oldest patients are and when they transition, etc. But it's no longer a disease of childhood, and young adults are wanting to grow up and deal with things that, like employment, having children, etc. And also there are adult health issues that we don't know about as pediatric nurses or pediatric doctors. And so they need to move on so that they can carry on with their lives, but having that support, knowing that the team they go to know about the things that affect adults with cystic fibrosis, and also for them to develop their independence in all of that.
سوالی موضوع صحبت شدیم که چرا ما گذار از خدمات کودکی بزرگسالی رو انجام میدیم. اول گفتیم که این مثل انتقال از یک مدرسه دراسه از یک پایه تحصیلی به پایه تحصیلی دیگر هستش که ناگزیر هستیم و یک بخشی از روند رشد هستش و گذار از دوران کودکی و خدمات کودکی به خدمات بزرگسالی باعث پرورش یافتن و تکامل حس استقلال میشه و موضوعاتی رو مطرح میکنه که قبلا مطرح نبود. و یک بخشش هم به خاطر این هستش که درمان‌های CF باعث شده که بیمارانی که در حال حاضر مبتلا به CF هستن طول عمر بیشتری داشته باشن و دیگه طب کودکان صرفاً پاسخگوی نیازهای اونها نخواهد. مسائلی که با افزایش سن رخ میدن مثل بارداری، مادر شدن، پدر شدن و تصمیمات دیگری که قرار در زندگی بزرگسالی اتفاق میفته به تنهایی از انجامش از سرویس کودکان برمی‌گرده.
So for a successful transition, we need to be supporting our pediatric population to move on in terms of their independence with treatment, looking at careers themselves, support them self-managing their care. And this won't be complete because their parents are always there in the background to help them, and we don't divorce them from their parents. They are a part of this process. And we want to try and encourage independence as much as possible, but that remains to work with the family rather than just the child. And just maintaining their general health, and that's what's we're here for, is to support them in maintaining their health. And so hopefully we can see that throughout when they transition. And the transition is a process. It's not just to send off to the adult team, but it's important that we support them to maintain their health and also think about careers, as I said earlier, and work. What do they want to do? And that's something that a lot of our young people are thinking about in terms of doing their exams, GCSEs here, and moving on to maybe doing A-levels and maybe going on to university, etc.
درباره گذار صحبت کردم و اینکه گذار موفق از خدمات کودکی و خدمات بزرگسالی مستلزم انجام چه کاری هست، چه اموری هستش. درگیر کردن خود بیمار به عنوان نوجوان در این پروسه خیلی مهم هستش و یادآور شدن که این صرفاً یک گذار ساده نیست که ما یک انتقال ساده نیست که بیمار را از خدمات کودکی به خدمات بزرگسالی منتقل بکنیم، بلکه یک روند هستش و چیزایی که باید در نظر بگیریم در این زمینه تشویق کردن روند، تشویق کردن استقلال نوجوان فرد هستش، برنامه‌ریزی برای آیندهش هست که میخواد در آینده چه کاری انجام بده، چه شغلی داشته باشه و کریرش هستش، چه کریری و چه شغلی در آینده قرار خواهد داشت و بهبود یا حفظ نشانگرهای سلامتش هست، مثل عملکردگی BMI و هموگلوبین A1C و اینکه تصمیم‌گیری برای زندگی آینده، شغل و خدماتی که قرار در آینده در اجتماع ارائه بده.
One of the issues, big issues sometimes, is disengagement with care or even coming to clinic. And that's something that we see in some young people. I'm not sure if you see it there, but certainly it's something that it's a challenge. It's a challenging set of behaviors from the patient and the parent, because the parent can't drag the young person into clinic. But certainly we try and engage as much as possible with them. And that is difficult. And I can tell you more about that another time maybe, but it is difficult to re-engage young people into care sometimes. Also, the reason we don't want them to stay in paediatrics, we don't want them to have inappropriate care. We want them to have care as an adult and what's appropriate for them and their age. So growing up and dealing with adult issues is really important, that they have the team behind them that can support them.
هستش که بیماران مبتلا به سیب باید پیوسته خدمات طب کودکان رو دریافت کنن یا خیر. یکی اگر این روند ادامه پیدا بکنه ممکنه اون خدمات به نحو مطلوبی که بناس دریافت میشه دریافت نمیشه و گاهی اوقات خدمات نامناسبی دریافت میشه و اینکه بزرگتر شدن و افزایش سن خودش مستلزم تماس مواجهه با موضوعات و مسائل زندگی بزرگسالان هستش که حتما باید ادامه خدمات در سرویس بزرگسالان انجام بشه تا استقلال نوجوان و اون روند انتقال به تیم بزرگسالان به نحو مطلوب انجام بشه.
So we have guidelines in the UK from NICE, which is the National Institute for Health and Care Excellence. And these guidelines came out in 2016, and they give us they are a guide, and they give us we formulated a pathway to deal with the way in which we transition our patients. So planned transition from early adolescence. So we invite the young people to a clinic to meet the adult team at about 14. Transition should be take place at a time of relative stability in their health. So we try to make sure that they're not requiring lots of treatment in terms of hospitalization, etc. At the time. Young people should be involved in the decision making and make an informed decision about where they want to have their care, because in the UK they do have a choice. They don't have to come to the hospital that's associated with us, they can go elsewhere. Young people should have a key worker, and that's something that the adult teams are now applying, and we do have a key worker here that our young people can get in touch with once they transition over to the adult service, and that key worker will follow them through for at least a year to 18 months, and that's their period of transition into the adult service here. Support should be provided, it says here, for 6 months, but we do that for much longer, as I just said. And transition, the key worker is the person who really I've worked closely with to try and re-engage some of our disengaged young people with.
گذار مطلوب معمولا از سن 13 تا 14 سالگی در زمینه از آغاز نوجوانی برنامه‌ریزی میشه. گفتن که در انگلستان یک مؤسسه هست که این گایدلاین‌ها رو تدارک به نام نایس National Institute of Care and Health of Excellence، مرکز مراقبت هست در انگلستان، که معمولا این گذار باید در زمانی رخ بده که بیمار و اون فرد جوان به لحاظ وضعیت سلامتی، به لحاظ وضعیت اجتماعی و تحصیلی در وضعیت پایداری قرار داشته باشه. اون فرد نوجوان حتما باید در روند تصمیم‌گیری دخیل باشه و آگاه باشه که تصمیماتی که داره میگیره در رابطه با مراقبت خودش چی هستش. معمولا میگن که برای افراد مراقب، برای جوانان که قرار گذار رخ بده، بهتر یک فرد خاص، یک نیتورکر، یعنی یک فرد خاصی وجود داشته باشه که این برنامه گذار رو برنامه‌ریزی بکنه و به شکل مطلوب باعث بشه که خدمات از کودکی، از سرویس خدمات کودکی و بزرگسالی رو پیدا بکنه. بازه زمانی که این خدمات پوششی باید انجام بشه 6 ماه قبل از گذار تا 6 ماه بعد از گذار هستش و در صورتی که لازم باشه تمدید میشه این دوره. این فردی که مسئول انتقال دهنده خدمات از طب کودکی به طب بزرگسالی هستش باید در نظر بگیره، کاهش بکنه که آیا این فرد تمایل داره که وارد یک سرویس دیگه بشه در لحظه گذار یا تمایل نداره، و به خاطر این هست که در انگلستان بیماران میتونن انتخاب بکنن که خدماتشون رو در چه سرویسی ادامه بدن.
Well, we work very closely with the adult team here to ensure that we have a smooth transition for the young people. And I work very closely with the key worker. We meet up regularly and we discuss the patients who are due to transition or to pre-transition. We do pre-transition as well. We also have meetings in terms of complex patients. So patients who don't just have CF, they may have another diagnosis. They might be severely autistic, or they might have a physical disability also. So those patients the process may change for them. And so we will adapt the process as we go along in terms to meet their needs. And so it's sort of giving them the message that we're there for them, but we're there to make it work for them as a family and as individuals as well. And it's something that I do regularly, as I say, and we review the process and transition document. And the document, I will probably have to email it to you because I wasn't able to put it on a slide, but I will probably send that over at some point.
نظام با سرویس خدمات بزرگسالان ضروریه برای اینکه یک گذار آرام و نرم از سرویس خدمات کودکی سرویس خدمات بزرگسالی تضمین بشه. این هم مستلزم ویزیت‌های پیوسته و مستمری هستش که بین سرویس کودکان و بزرگسالان و اون فردی که نید کیورکر که مسئول گذار هست انجام میشه. با بیمارانی که مشغول گذار هستن حتما باید بحث بشه، مباحثه بشه، در جریان این بیماران حتما قرار بگیرن. بعضی بیماران پیچیده هستن، شرایط خاصی دارن، ذکر کرد که بعضی از بیماران CF هنرمند هستن و شرایط خاصی رو دارن، توانایی و استعداد خاصی رو دارن. بعضی از بیماران دیسیبل هستن، ناتوان هستن که اینها شرایط گذار رو از یک سرویس به سرویس دیگر رو ممکنه این مقدار بحرانش بکنه. انتقال پیام بین این سرویس ها حتما باید مثبت و همراه با سیگنال های مثبت باشه تا روند گذار بهتر انجام بشه و نهایتاً اینکه موقعی که داره گذار انجام میشه روند گذار از خدمات کودکی و بزرگسالی و مدارکی که حتما لازم هستش که یک سرویس به سرویس دیگه تحویل بده مد نظر قرار بگیره.
So timing of transition. So usually that we'd make sure that the patient is well. So timing transition varies by country and region, but in the UK generally young people usually go to the adult service after 16, and this is after they've done their exams at secondary school at GCSEs, after GCSE exams. In mainland Europe it's round about sort of 18. And whereas in the US, it could be anything up to 21 when they transition. So it varies internationally when people and policies and guidelines vary internationally.
سنی که معمولا گذار درش اتفاق میفته باید مطمئن باشیم که بیمار کاملا حال عمومی خوبی داره و به لحاظ شرایط طبی و اجتماعی استیبل هستش. سنی که در اون شرایط گذار اتفاق میفته تحت تاثیر قوانین و مقررات ملی و قوانین کشوری هستش و ممکن در کشورهای مختلف فرق بکنه. گفتن که در بریتانیا در UK در 16 سالگی اتفاق میفته، در ایتالیا اروپا در 18 سالگی و در آمریکا در 21 سالگی گذار رخ میده که این بسته به سیاست‌های هر کشور هستش. پس بنابراین در جوامع بین‌المللی بین کشورهای مختلف این روند گذار ممکنه متفاوت باشه و شرایط گذار در هر کشور ممکنه با هر کشور دیگه تفاوت داشته باشه. ولی نکته خیلی مهمش اینه که هر موقعی که قرار این روند انجام بگیره بیمار باید به لحاظ طبی و به لحاظ اجتماعی در وضعیت پایدار قرار داشته باشه.
So at the Brompton, we discussed transition very early. So a lot of us as nurses, we'll talk about it from diagnosis, you know, that sort of period around then, but not at diagnosis, but we'll talk about it from a very early age with the parents. At 14, they are invited to a pre-transition clinic. So the letter goes out to the patient and the parent. It's addressed to both of them, inviting them to come to a pre-transition clinic where they'll meet the adult team and my counterpart. There's lots of information provided. So the CF Trust, like your trust in Iran, they provide a lot of information about transition, and there's a booklet on their website if you want to have a look at it, and it's quite useful. We also here provide them with a Royal Brompton video At the moment, our booklet's being reviewed, so that's not available at the moment. So that's being rewritten, but we will that will go out to young people and their families. They also get what we also do a medical, an MDT, pre-transition document, so that the adult team have some idea of the patient, their family, what their condition is like, their disease progression, etc. At that first meeting. So that's really important. And as I said, they meet the adult team, they meet our counterparts. So they'll meet the adult consultant, sometimes a psychologist, the dietitian, the nurse, and the physiotherapist. And so they take part in that pre-transition meeting. They are also offered a second pre-transition clinic at 15 years. So we like them to come along again, so that if they've thought about anything they want to ask, if they decide that they want to go somewhere else, then at least we can talk about it at that clinic also.
بیمارستان برونتون روند گذار در سنین خیلی پایین آغاز میشه و در مورد گذار خیلی سریع شروع میکنن به صحبت کردن. در 14 سالگی بیماران دعوت میشن که به یک کلینیک مراجعه بکنن که حالا اصطلاحاً بهش میگن پیشگذار و نامه در اختیارشون قرار داده میشه و والدینشون نامه نوشته میشه، اطلاعات در اختیارشون قرار میگیره که روند گذار به بنیاد CF در انگلستان رو در اختیارشون قرار میده. این اطلاعات رو کتابچه‌ها و ویدیوها در اختیار بیماران قرار میگیره که آشنا بشن با خدماتی که قرار در سرویس بزرگسالی دریافت کنن و این معمولا این مستندات که برای روند گذار لازم هستش توسط یک تیم چند تخصصی نوشته میشه. معمولا بعد از اینکه میخواد قبل از اینکه گذار بخواد انجام بشه تیم بزرگسالان هم حضور پیدا میکنه، چون تیم بزرگسالان هم ممکنه ایده‌هایی داشته باشن، افکاری در مورد مریض داشته باشن، نظراتی داشته باشن، ممکنه ملاقات‌هایی با فیزیوتراپیست متخصص تغذیه، پزشک پرستار هم انجام بشه که روند گذار رو آسان‌تر بکنه. معمولاً یک ویزیت یک روند دومی هم یک روند گذار دومی هم در سن 15 سالگی براشون تدارک دیده میشه در بیمارستان انگلستان که آماده‌ترشون بکنه برای انتقال خدمات به سرویس بزرگسالان.
So then prior to transition, we have a document, as I said, a pathway that we use, and a transition letter will go out with the documentation, but there's also a bit for them to fill in about them. So we like them to introduce themselves to the adult team in writing if they can, or pictures. If they want to draw a picture, that's absolutely fine. But usually they write something about them, their family, what they like, what they don't like, what they hope for the future. So those things are all about me. And so we try to get them to fill in that, because a lot of the other bits of the document is all data about lung function and the demographics, etc. But it's nice for the adult team to know a little bit about that young person prior to the transition clinic.
که بزرگسالان اتفاق بیفته مدارک مورد نیاز فرستاده میشه و تیم بزرگسالان میگن که معمولا مدارکی که مورد نیاز هست که توسط تیم کودکان فرستاده بشه شامل اطلاعات مردم‌شناسی دموگرافیک و داده‌های تشخیصی هستش، اطلاعاتی که در مورد حوادث زندگی برای فرد رخ داده. ولی میگم چیزی که برای خودم جالب‌تر هستش اون تمایلات و اون ویژگی‌هایی هست که افراد مبتلا به CF بیان می‌کنن، مثلا تصاویری که از خودشون گرفتن، نقاشی‌هایی که کشیدن و سایر چیزها، به خاطری که این چیزهایی که معمولاً هستش اطلاعاتی مثل عملکرد ریه‌ها یا وضعیت سلامتی معمولاً همیشه فرستاده میشه و چیزی کم و کس نیست و ما با این روند خیلی آشنا هستیم. اما چیزی که من مشتاقش هستم و همیشه بدونم اطلاعاتی هستش که کمک می‌کنه اطلاعات بیشتر از بیماران داشته باشه.
So at that clinic, we'll have a pre-clinic meeting, and where the MDTs of both sides, the adults and pediatrics, will discuss the patient. So there'll be a formal sort of handover, if you like. And then they'll be seen in clinic by both teams. And then part of that, again, they'll discuss the structure of how the adult service works how outpatients works for the adult service. This would have been discussed previously at pre-transition clinics as well, and how to contact the nurses, etc. How the segregation policy works in terms of clinics, because they run a slightly different way to the way pediatric clinics run, although everybody goes into a room, so everybody's segregated when they come to clinic, so nobody's waiting in a waiting area. They have an option to visit the adult space, so the ward or the outpatient facilities. And if they're happy with all of that, then they'll transition that day, but they'll have to wait for their transition appointment. And until they're seen by the adult team, they are still our patient. And once they have their first adult appointment, then they are the responsibility of the adult team and the key worker mainly.
قرار ملاقات در یک قرار ملاقات گذاشته میشه. متخصص کودکان در ملاقات حضور پیدا میکنه و راجع به نحوه ارائه خدمات و اطلاعاتی که قراره در آینده اون فرد بیمار باهاش مواجه میشه در این باهاش صحبت میکنه و تحلیل رسمی از طرف تیم کودکان انجام میشه. متخصص کودکان درباره ساختار ساختار خدمات بزرگسالان، نحوه دیدگاه سرپایی، امکانات بخش‌ها و اینکه چگونه با پرستاران متخصص CF تماس برقرار بکنن توضیحاتی ارائه میده که خط مشی‌های کلینیک‌های بزرگسالان و قوانین و مقررات کلینیک‌های بزرگسالان رو توضیح میده و این انتخاب رو این گزینه رو در اختیارشون قرار میده که بخش بزرگسالان بازدید بکنن و با امکاناتش آشنا بشن. اگر بیمار این شرایط فرصت میشه، اولین آوتپیشنت ویزیتی که انجام خواهد شد برای شوخی بزرگسال انجام میشه و اگر نه راضی نباشه و با این خدمات نتونه کنار بیاد، میتونه کلینیک گذار دیگر انتخاب کنه. به خاطر اینکه اولین باری که تیم بزرگسال ویزیت بیمار CF رو انجام بده، از اونجا به بعد مسئولیت ارائه خدمات به عهده بزرگسالان و تیم بزرگسال خواهد بود و اینکه نهایتاً این تیم بزرگسالان تصمیم گیری می‌کنه که قرار ملاقات‌های بعدی در کلینیک در چه زمانی اتفاق بیفته.
So this slide is just telling you what we've just heard about. So the key worker is the person who really is the point of contact for that young person and their families, so they can contact them by email, etc., telephone, and they are there really as an advocate for that patient and to help them navigate their way through the new service that they've joined.
همون کیورد کارمند کلیدی که باعث فرد مسئولی هست که گذار رو برده بگیره بسیار مهم و اساسی هستش. معمولا نامه‌نگاری یا تماس تلفنی یا ایمیل بین 6 ماه تا 12 ماه مدت طولانی‌تر برقرار میشه بین این خدمات که بین این سرویس ها که باعث میشه گذار ایمیل و آرام بین این دو سرویس.
Again, it's just talk about the ongoing support that they get from the adult team, and that's just reiterating what we've just said. And that's ongoing support with the key worker. The next slide just sort of talks about parents' concerns. So parents are concerned about the fact that they're moving to an adult service. Will they no longer be involved in their child's care? They're probably thinking about the quality of care, the care that they've had with the pediatric team that they've been so closely connected to. Will it be the same? And so it's building new relationships, and that's going to be difficult in the first year or so. But we encourage that, and the young person can take along whoever they want to their appointments, either a parent, boyfriend, girlfriend, or support worker of some kind. So it's just helping them to develop their independence. Both they'll have emotional and psychological support that's needed if required by the adult team. There are psychologists who provide support there, and we can transfer on any needs that that individual patient may have. They may not have any, they might have been supported by the psychological team in pediatrics, and so that might be ongoing, and so that's something that we may follow through. They may follow through in the adult clinic, and just giving them, being able to get them confident to navigate the adult healthcare system, because sometimes they not only have to come to one hospital, they might have to go to another hospital for associated other problems. So it's important that they know where they're going and what they need to do. And at the end, sorry.
مثلا یکی ازش نگرانی والدین هست که به خاطر اینکه قبلا والدین داشتن خدمات رو در محیط کودکان دریافت می‌کردن و حالا محل ارائه مراقبت بهداشتی در سرویس بزرگسالان هست، نگران این هستن که کیفیت خدماتی که قرار بهشون ارائه بشه مطابق سرویس کودکان هست یا نه، و اینکه اونها قبلا با سرویس کودکان خیلی خوب گرفتن و پزشکان کودکان و تیم مراقبتی درمانی بهشون خیلی نزدیک صمیمی دیدن. مسئله بعدی ایجاد روابط جدید هستش که روابط جدید ممکنه در خصوص در سال اولی که وارد این خدمات میشن چالش قرار میگیره. و مسئله دیگر این هستش که باید به نوجوانان یاد بدیم که روند استقلال خودشون رو به دست بیارن و بتونن خودشون رو مدیریت بکنن. مسئله دیگه که در این موضوع مهم هستش این احساس نیازهای مراقبت روانی هستش که بعضی موقع نوجوانانی که وارد این سرویس میشن نیاز به حمایت روانی داره، روانپزشکی داره که روانپزشک‌هایی هم حاضر هستن در این سیستم خدمات روانپزشکی رو ارائه بدن، مخصوص سیستم بزرگسالان هستش. و اینکه بالاخره باید به نوجوانان و جوانانی که وارد گذار میشن و میخوان خدماتشون رو در سرویس بزرگسالان دریافت کنن اعتمادی داد که بتونن راه خودشون رو در سیستم خدمات بهداشتی درمانی بزرگسالان پیدا بکنن. بیا بدین جایی.
So it's not only the sort of going to the adult service for the young person, it's also the parent having to transition as well, and so they feel they've lost control and involvement. Maybe the young person may be wanting to be more independent. The parent might not be ready for that independence, but they're worried about continuity of care so that the child, the young person continues to do the treatment that they need to. The child's well-being emotionally as well, and again, as I said, just navigating the healthcare system.
سوال نگرانی والدینی که نگران هستن که اون کنترل و مراقبتی که قبلا بر خدمات دریافت خدمات داشتن از دست بدن، اینکه آمادگی اینو ندارن که ممکنه اون بیمارشون نیازمند استقلال باشه، آیا نگران هستن که میتونه مستقل باشه یا نه، نگران یک پارچگی خدمات هستن، اینکه آیا خدمات ادامه پیدا خواهد کرد یا نه، و مسائل و نیازهای عاطفی و روانی هستش که ممکنه بیمار در طی گذار از سرویس کودکان به سرویس بزرگسالان باشه مواجه بشه و نهایتاً اینکه آیا بتونه راه خودش رو از سیستم بهداشتی درمانی بزرگسالان پیدا بکنه یا خیر.
So it's just taking into consideration the young person and family's circumstances. The child may have physical or emotional health needs, and so those need to be met, and it may be that they transition at a different time frame from the norm, but usually most patients will transition by the age of 18.
هستش اینه که مواردی هستن که باید روند گذار رو یک مقدار تغییر درش رو بکنیم و در نظر داشته باشیم که شرایط فرد جوان، خانواده‌ها و شرایط فردیشون چی هستش و روند گذار معمولاً در سن 18 سالگی اتفاق میفته.
And these are sort of three quotes that are taken from the All About Me page that the young people write, and when they're filling it in, and it's quite interesting. The road travelled with cystic fibrosis is often deserted, devoured of like-minded companions, and that's because obviously segregation, they don't get to meet they don't get to meet other people with cystic fibrosis, and so that's really difficult in person, that is. Healthcare professionals eventually become part of the extended family because they come to clinic so often. They get to know us and we get to know them. I have all the usual teenage angst on top of cystic fibrosis worries. And that's one of the things that you see quite often, you know, they, as well as, you know, it's friendship groups, trying to be like other people, doing the normal things, going out, drinking, getting drunk, you know, those sort of things. They want to be normal and want to be seen as being normal and not just a label of cystic fibrosis.
مسائل دیگه که مطرح هستش ذهنیت خود بیماران هست. میگه که مسیری که بیماران CF اغلب طی میکنن و دارن مسافرت میکنن اغلب خالی از گیاه و صحرایی است و عاری از همراهانی هستش که به ذهن باز ما رو همراهی میکنن. و نکته دیگه اینه که میگه مراقبین بهداشتی نهایتاً جزئی از خانواده ما میشن، از خانواده بزرگتر ما میشن. و این مسئله دیگه که مطرح کردن تو صحبتشون این بود که ما نوجوانان و جوانان CF به عنوان یک فرد جوان نیازهایی داریم مثل سایر نیازها. دوست داریم زندگی بکنیم، لذت ببریم، شاد باشیم، از زندگی لذت ببریم و دوست نداریم با این برچسب CF از ما یاد بکنن. و نهایتاً این که جمله آخرش میگه که من همون نیازهایی رو دارم که نیازهای یک فرد نوجوان هست، علاوه بر این که مبتلا به CF هم هستم و نگرانی‌های بیماری خودم دارم.
And these are some of the things that we do quite well here. They do have a transition key worker in the adult service, so that's really good. So young people have a point of contact, and I think that's really important. We have a hospital school, and that's really, they play a really big part. They really support the young people, particularly those going on to further education who may well be doing A-levels or going on to university. They are there to support them and give guidance as well. They have a careers advisor there, as I said before. And we review our practice from time to time. We do audits and QI, trying to improve the service as much as possible, asking the young people themselves what we can do to improve the process. And also in the adult service now, they have adult psychologists, which is very useful for a lot of our young people who are transitioning across and have used the psychology service in pediatrics.
کاری که دیگه به خوبی در این گذار انجام میشه اینه که ما یک فرد رو داریم، کارمند اساسی داریم که معمولا روند گذار رو به عهده میگیره و یکی از خوشبختی‌های ما این است که یک هاسپیتال اسکول داریم که نقش مهمی ایفا می‌کنه در روند انتقال بیماران از سرویس کودکان به بزرگسالان. این باعث میشه که ما هر ساله مرتب نحوه ارائه خدمات رو بازبینی بکنیم و نهایتاً اینکه در تیم بزرگسالان ما روانپزشک و روانشناس وجود داره که در صورتی که بیماران نیاز داشته باشن خدمات روانشناسی و روانپزشکی برای بیماران انجام میدیم.
One of the things is the clinics can be quite enlightening and fact-finding. They can be quite emotional for us as caregivers, but also for the families as well. So, you know, saying goodbye, farewell to young people that you've looked after since they were a baby, it can be quite emotional. And also the family, because you know you've been there to give them support. So it is one of those clinics that sometimes I dread it because it can be quite emotional.
به عنوان تیم بزرگسالان و در موقع گذار باش مواجه میشیم که گاهی اوقات محیط کلینیک‌ها و محیط درمانگاه‌ها حاکم از مسائل عاطفی میشه و بیماران درگیر مسائل عاطفی میشن و این موضوع دیگه این هستش که ما مدام باید سطح خدماتمون رو افزایش بدیم، کیفیت خدماتمون رو افزایش بدیم و این کیفیت افزایش بهبودها گاهی اوقات روند چالش برانگیزی است برای ما. و مسئله دیگه این هستش که باید نحوه کیفیت گذار رو هم افزایش بدیم که گاهی اوقات ممکنه این دشوار باشه.
I know you don't currently have access to modulators, but due to the fact that advances in treatment with cystic fibrosis, the adult population will be growing. Transition to the adult service is a key milestone for a lot of our patients. Early discussion is essential to prepare the young person and their families for this process. working together as an adult team and with the pediatric team is really important so that we can bring the services together and work jointly to make the transition to the adult service as smooth as is possible. Meeting the adult team prior to actually going to the adult service, I think, is one of the key points. Trying to make sure that they're not so anxious about what to expect when they go, and also that's for the parents as well, their expectations of the service and how it runs, etc. And just supporting these young people with a key worker, I think, is one of the most important things for me anyway, so that I can always talk to my counterpart in the adult team and see what's happening. And we work together if patients aren't able to come through and follow up if they disengage, and that's really important. So thank you.
مسئله گذار سیستم بزرگسالان یکی از سنگ‌بناهای این روند درمانی است. باید بحث‌های زودهنگامی انجام بشه با والدین و بیمارانشون و با بیماران و خانواده‌هاشون که آماده بکنن اونها رو برای روند گذار و از سرویس کودکان به سرویس بزرگسالان و سرویس کودکان و بزرگسالان باید با همدیگه همراهی بکنن تا مطمئن باشن که یک تحویل آرام و نرم بیمار از سرویس کودکان و بزرگسالان اتفاق میفته. قبل از اینکه گذار اتفاق بیفته باید با تیم بزرگسالان حتما ملاقات انجام بشه و بیماران و والدین این کار باعث میشه که اضطراب بیمار و والدینش کاهش پیدا بکنه و نهایتاً اینکه اون ترانزیشن کیورکر یعنی کارمند اساسی که نقش انتقال میگیره نقش بسیار مهمی داره و باعث میشه که این روند ارائه خدمات از کودکی تا سرویس بزرگسالان به شکل پیوسته باشه. Are you finished?
And there we have some references. I'm sure you'll let them have those as well. But I can also send you the link for the video that we show the young people. Unfortunately, it wouldn't run. I tried it earlier and it wouldn't run on the slide. So that's why I haven't shown it today. But certainly I can send that to you. Thank you. Can I ask a question?
Yes, I brought a question.
Can I ask a question?
Yes.
What do you do in terms of transition, and do you transition patients, and when would you do that? What age would you do that?
Excuse me, can I ask the audience's questions?
Yeah.
The first question is that is transition from pediatric team to adult team in England mandatory or not?
Yes.
It's mandatory, yes?
Yes.
Okay, thank you. And the second question is that who is the key worker of the transition? Is he a nurse or, for example, a doctor or?
What, the key worker?
Yes, the key worker. The transition
currently it's a nurse, but it could equally be a physiotherapist. I don't know if the doctors would have time to do that job, so I would probably put it down to being either a physiotherapist or a nurse, maybe a dietitian, but I think probably a physiotherapist or a nurse, because we have probably a lot more time with the patient. I'm talking about, not that we have more time than anybody else, but we spend a lot more time with the patients. Any other questions? Yeah. Sorry?
And another question is that about sexual issues. Do these patients in transition phase also have problems with sexual affairs, or they are just about fertility or other problems?
Well, we talk about fertility with the young men and with the young women. So it is something that comes up, and we talk about it at our annual review. So it's something that we do every year, or even it doesn't have to be at the annual review, it might be in a clinic, but certainly we do talk about sexual health. So we'll talk about fertility with boys and girls, and what they need to do in terms of if they're thinking when they're older, if they're thinking of having children, then in the adult clinic they can talk about the various processes that they can go through in terms of checking their fertility, and we can talk about that too in pediatrics.
سکشوال حتما باشون صحبت میشه، راجع به مسائل مثل فرتیلیتی، باروری و اینکه در آینده قرار نقش مادری و نقش والدی به عهده بگیرن، حتما صحبت میشه باشون و جزئی از مراقبت‌هاشون هستش و این خدمات انجام میشه. Thank you so much, Jackie, for your useful information and for devoting your valuable time to us. I personally used so much, and thank you.
Can I ask you a question?
Yes, thank you.
I just wanted to know, when do you transition your patients? At what age?
If I want to answer clearly, it is not planned and it is not written clearly, because CF in Iran is a new rare condition, as in it is a new entity.
Okay.
And so we are going to develop the strategies to deliver the patients safely, but it is not written officially, and it is not prepared well.
Okay. And how many patients do you have in Iran with CF?
3,900.
Okay. And the age range from?
Different age ranges. I think the oldest is about 61 years old.
Okay. Thank you.
Thank you so much.
Thank you.
Thank you, Jackie, for your amazing presentation. I'm excited for your valuable presentation, for your knowledge and for your skill, and we learned a lot in this session, and I appreciate for your time spending.